As Minister for Indigenous Health and the first Aboriginal Australian to be appointed to the Federal Ministry, it is my great honour and responsibility to work for better health outcomes for Aboriginal and Torres Strait Islander people in this country. Health outcomes for Aboriginal and Torres Strait Islander people should be equal to those of non-Indigenous Australians. Closing the gap is our map to that clear destination, setting clear and tangible targets to achieve equality in health outcomes for all Aboriginal and Torres Strait Islander people. I welcome the latest annual Closing the Gap report, which holds all governments and all ministers to account as we walk together along that path. This year's report shows mixed results and provides us with the opportunity to consider our course and reinvigorate our commitment to this fundamental task. Rates of Indigenous child mortality have declined by 33% between 1998 and 2015, and Indigenous life expectancy has increased since 1998. The Indigenous mortality rate from chronic disease has declined significantly by 19% between 1998 and 2015. However, we are not currently on track to meeting the Closing the Gap target set by COAG in 2008. The health of Aboriginal and Torres Strait Islander people is slowly improving, but the current rate of progress will have to gather pace if the life expectancy target is to be met by 2031. We know that the social and cultural determinants of health are central to these results, including factors such as housing, education, employment, and interaction with the justice system. I'll be doing everything I can as Australia's Minister for Indigenous Health to tackle barriers to better health. But in truth, closing the gap is everyone's responsibility. Every parliamentarian, every Australian working to make change across the health and community services sector in our daily lives and endeavours. The government's new Directions program under the Better Start to Life initiative is a great example of change in action. We see community-led intensive intervention by nurses and Aboriginal health workers specially trained to support mothers from early pregnancy all the way to starting school. The Waminda service on the south coast of New South Wales runs a government-funded program called Dead or Deadly. This is an example of how physical activity and exercise, nutrition, smoking cessation and chronic disease prevention and management can be integrated into a program delivering health benefits for the community. Through this program, we have seen positive gains in mental health, well-being and smoking status, including a reduction in the risk of developing diabetes. This program specifically addresses needs of high-risk groups, women, children, and provides pathways for support and education for people to make healthy choices. Only by working together can we achieve our goal. Closing the gap is just not an Indigenous issue. It is an issue for all of us. It is an issue for our nation. I look forward to us continuing to work together to make greater strides in our journeys together as we address the gaps. In addition, I want to acknowledge those examples of work right throughout this nation where Aboriginal community-controlled health organisations and state and territory health systems have had outstanding successes, and acknowledge that there are jewels in the crown. We have to build on these if we are to make a difference in closing the gap and increasing life expectancy. Thank you.